Welcome, everybody. Nice to see such a great crowd. Can everybody hear me? That's usually not a problem. I'm told I talk loudly, but whatever. But anyway, we're here to talk about falling and falling strategies and so forth and so on today. And is falling normal for aging? No, it is not. It's because we haven't addressed and accommodated to our aging bodies. And so we need to think about that. We also need to know that it's not a good idea to stop going out and doing things because you're afraid of falling. You need to get your butt out there and move. Very important. I'm a great believer in moving. That way, like an ice cream. Is that better? Oh, good. So indeed, it's good to get out. And the nice note is, if you're really good and exercise, you can diminish the effect of aging that is normal. Because do your brakes on your car wear out? Mine do. I have to refurbish them in some way or I'm in trouble. So the same with our bodies. As we age, we need to recognize we need to change our way of living. One of the interesting facts I came across in preparation and rereading some stuff is that the 60-year-old needs 3 times the amount of light to read that a 20-year-old does. And that has to do with the changes in all our eyes, and there's not much you can do about it. It just happens. But you can get a task light or something like that. So indeed, keep in mind, while we'll be talking about some changes, we can address them. And the reality is we're really in shape. We only leave about 10 to 15% of our usual functioning as we age. So, and you'll hardly notice that. Now, we do need to look at some of the reasons why we do and what we do lose, and that has to do with senses. Senses, meaning eyes, ears, nose, throats, not this. It's also on strength and stamina. And again, what are you doing to keep up your stamina? Very important, and we'll be talking about exercises and so forth that you need to be doing. So what we're going to talk about is general information about falls, including what causes, prevention, measures, and a self-assessment risk. And we're going to identify exercises to promote balance, endurance, flexibility, and strength. You should be doing something every day for these 4 realms. And stop and think about it, okay? And then we're going to discuss techniques to get into a chair after a fall and discuss principles and techniques on how to fall safely. I added in, because last 2 times I did this, somebody requested that I show how to get in and out of a chair. And indeed, if you're dealing with a low chair, it's much more difficult than if you're dealing with a chair that's a little higher. So that's just one general principle. So some of the things we need to talk about, 1 out of 5 falls create broken bones, or traumatic brain injury. Has anybody fallen this year? Boy, I sure have. But you know what? I'm out there doing it, and I'd rather be out there doing it and falling than sitting home watching TV, which there's not much very good on anyway. 2.5 million people are treated in our ER from fall injuries. And there's a statistic that says of the people who break a hip in 1 year, some go home, about 25% go home, 50% will spend the rest of their lives in a nursing home, and 25% will die within the year. You don't want that to be you. That's why you're going to get up and exercise. 700,000 people are hospitalized yearly in the United States today. And the other thing is, the most common cause of TBI, what's TBI? Traumatic brain injury, is a result of a fall. So keep this in mind, and you yourself can do a lot to prevent all this from happening to you. Now, why do falls occur? There are normal aging changes which happen to all of us. That's just the way life goes. And neurologically, whether you know it or not, you have a writing reflex. Does anybody think about their writing reflex? Well, you should. And that becomes diminished in effect as we age. And that's what, when your righting reflex goes into action, it fights to get your body back into normal alignment. And so keep that in mind. The other thing is, what about your reflexes? When I drive with my daughter, she'll tell me, Mom, you didn't put the brake on yet. Well, I have my foot on it ready to go, but she can't see that. But my reflexes are nowhere near as fast as they were when I was 40 even. I'm 80, by the way, now. And then there's your proprioceptive responses. Have you all worried about that? They are located in your muscle spindles. And that's how, if you close your eyes, can you tell me where your hands and feet are? If you couldn't do that, could you drive even? Not really. So you need to keep those proprioceptive responses in good shape. And they're located in all your muscles. How do you keep them in good shape? Exercise, you bet. So indeed, they're the major 3 neurological things we'll talk about. Then we have to talk about gait. That's really significant in that, unbeknownst to ourselves, we can start walking like this. You need to think when you're walking, are your shoulders back? Are your, when you're stepping, are you stepping like this? Not like this. I worked with a friend of mine. She lived in my neighborhood, and she said, the physical therapist wants me to walk with you. I happen to know the PT. And she said, you take her, they want you to go out, and you're to go, march, 1, 2, 3, march, 1, 2, 3. And what was she doing? She was doing, march, 1, 2, shuffle, 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 shuffle. And so, to this day, she still doesn't do well because she never was willing to get away from that shuffling. So if we shuffle, shuffle, our gait becomes less wide. We walk slower. Okay, we stop swinging our arms, which is helpful, and we're leaning into it. Very bad. So is there anybody here that can't stand up with their shoulders back? Is there anybody here who can't be aware of their stride? Now, I'm not saying do massive strides, but do indeed have a decent stride. And the other thing we tend to do is lean forward. That's really bad. Because is that going to make you fall? You bet. So you need to do that. So be aware of your gait. And one of the things which I do, I hike a lot. I walk a lot. I try to do about 7 miles a day. And what else? Well, do you sit down when you talk on the telephone? I don't. I walk around the house. I also hike and walk quite a bit. So be aware of your gait and how you're. The other thing, when I get tired, and sometimes I do, and yesterday I was walking with a group, and we were going, I was tired, I didn't sleep well the night before. Well, my feet start dragging. So as I was walking up the various stairs that we were covering, there's 162 stairs, I was going, lift, 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 because I didn't want to catch my toe and fall like I've seen a lot of people fall. So then I'm focusing. So you need to focus on how you're using your body. Make it your own, your body. Nobody else can do it for you. Okay? So we got gait training done. Any questions, comments? I was telling somebody I was teaching at the College of Marin, and I had cords, and I tripped and fell on the cords, and I laid there and I said, well, now that I've got your attention, but I'm conscious of it, but you're right. And that's something in your own house you need to watch. Vision. As we age, our lens becomes more fibrous and hard and stiff. Therefore, what do we get when we're 45 or 50? Bifocals, because our eyes can no longer adjust like they used to. So we need to keep that in mind. We also, as I said earlier, need 3 times the amount of light that a 20-year-old does. So I found myself buying a task lamp. Have you seen those? And what I'm alluding to is, You have to accommodate your body to you have to accommodate to your body changes. It's just the way the life goes if you're going to be happy. Hearing. Interestingly enough, by 60, we all have some diminution in our hearing. However, unfortunately, or fortunately, I don't know which, hearing loss is more dominant in men than women. Don't ask me why, I don't know. So keep in mind, you should get your ears checked that you can hear. Muscle mass. What happens to your muscles? Whether you know it or not, they are losing tone, they are losing stretch, unless you're doing something about it. You can repair that. And again, while you're talking on the phone, so I don't trip and break my fool neck, I walk around the house. What am I doing? Lift, lift, lift. And I don't say it that loud or the person on the phone couldn't hear me. But indeed, and there's many places you can do it. I don't go lift out loud at the food store, but why not? I mean, I can see as well while I'm lifting my legs. So I'm working on my quads all the time. Okay, and so muscle mass is very important. All research says everybody in this room could possibly benefit from it. I went to, I'm having some back problems, so I went to PT and I went through all my exercises and I thought, boy, what a gem you are, Carol. She said, the PT looked at me and said, I think you could use improvement. I thought, oh, Lordy. So anyway, as much as I do, the physical therapist said I could use improvement, so off I'm going to learn how to improve. Bone strength. Now, bone strength is an issue for all of us as we age. We can get osteopenia, and then our bones can go into osteoporosis and fracture easily. But again, what are we doing? You've got to be doing some resistance. Remember the 4 areas that have to be talked about, and Regina will be covering that. You have a booklet in your materials which she'll go through with you to talk about all those exercises. Again, let me reinforce, don't do exercises that are hard for you, or check with your doctor to be sure that he knows your underlying conditions and can provide you guidance on that. The other thing which they were finding is vitamin D. They're finding we had an epidemic here in the United States. We were using so much sunblock. Where do you get vitamin D mostly? From the heavenly sunshine. And indeed, we were getting low on vitamin D. So now Kaiser tests everybody for vitamin D now. And if you need it, they'll have you take supplements or get out and get some sunshine. Without sunblock, of course. Okay, any questions or remarks? Over here.
So I have a friend, and I've seen this in many people, who likes to walk. She stands up straight and she has good posture, but she walks with her head down like this. Why? Because she's afraid of falling.
That's
and
right.
I have found out that affects your inner ear, which affects your balance, which could make your probability of falling greater.
Yeah, you're absolutely right. I can tend to do that. So what I've done is try to change the surfaces that I'm walking on, that I'm not doing this, because I'm very guilty of that. So I'm not surprised at all that other people do the same dumb things I do. Yeah, I know, but you can walk like this. In my neighborhood, a lot of the sidewalks have uplift in them, and they're very easy to trip on. And so I'm very cognizant of that. But yeah, it's a problem. Yeah. I have one over here.
Carol, can you address drop foot? Because a lot of people trip and don't realize they have that weakness.
That is usually some paralysis of your peroneal nerve, and I'm not sure there's a whole lot of therapy for that at this point. Drop foot is drop foot. And it is a problem because the person's kind of just kind of mobilizing along without, sorry, don't have a better answer.
Carol, do you want to have time for questions at the end?
Yeah, why don't we do that? Because I'm getting behind. The faster I go, the behinder I'm getting here. Okay. Other reasons people fall. Cataracts. A lot of us will develop cataracts at this point simply because we haven't worn sunglasses and we're in the sun a lot here in California. That will change your vision tremendously. Arthritis can be a reason to fall simply because you know you're hedging on something because you know it hurts and you don't want to do that. Strokes, minor strokes. You may not even know you've had a stroke. It can be a problem. And then dizziness can occur for a variety of reasons. One of the more common one is what? Medications. I have a friend on 3 meds, all have a side effect of hypotension. That's low blood pressure. And she was reporting to me, and I said, you need to talk to your doc and get off of one of them at least. So indeed, she's looking at that. I'll also mention this, and I think it's on the next slide. Dehydration is another reason for dizziness, as well as headache. A lot of times when I have a headache, I just haven't kept up with my water for that day. I put 64 ounces on my counter when I get up in the morning. That's to be gone by 8 o'clock that night, kind of thing. Now, again, you've got to adjust to adapt to your body's changing needs. That's just the way it is. Urinary tract infection. When I was in the hospital, I'd be talking to a patient Monday, be fine. Tuesday morning, I'd walk in and they didn't know what month it was or anything else. First thing I would do is call the doctor. Can I get an order for a urinalysis? And indeed, 9 times out of 10, they'd come up with a urinary tract infection. So keep that in mind. Cardinal sign of urinary tract infection is confusion. Pneumonia, we don't have enough oxygen getting in there. And, I want everybody to take a deep breath and hold. Did you get it down into your lower lobes? I mean, you have to think about it because you're not using those guys if you don't. So, indeed, I try to take a real deep breath and get that down into my lower lobes because I want my lower lobes to be happy. Dehydration, I already talked about. GI distress. As we age, there are changes in our GI system, which, the musculature, the esophagus doesn't work as well because it's a muscle. I can also get increased gas from what I eat, or if I eat too much, our stomachs get smaller. We need smaller portions of food to help our stomachs along, and then they don't get upset. And then low blood pressure can be from a variety of reasons, dehydration being one of the most common reasons, and we talked about that a little bit. Inner ear problems, somebody mentioned that with your vestibular nerve. It's a cranial nerve, and indeed, there's 3 dimensions to losing balance, which Regina will cover. And that's about that. Other reasons. Difficulty walking for any reason puts you at a high risk for fall. Medications, obviously, if there's some that make you dizzy, if there's some that drop your blood pressure, all problems. Your environment. I'm not going to spend a lot of time on environment, but we will spend more time on indoor. But about outdoor, we have to be aware of what's the surface we're walking on. I once in a while go up the King Mountain, which is always a mistake for me because the scree coming down, I'm slipping and sliding on it. I'll have to tell this story because it's so funny. I was in Beijing and I went out to the Great Wall and it was in the middle of a blizzard. It was November 9th. And my goal was to walk a mile or 2 on the wall. I got up to the top of the wall after much struggle getting up 2 flights of stairs. No railings, the rises are uneven, and people are slipping and sliding into other people. And I'm sitting here thinking, the last thing I need to do, I'm 6 days into a month-long trip, I'll be doggone if I'm going to get injured. So I looked around, and at the top of the stairs, there were 5 women sitting there or standing, laboring over what to do. And I thought, just bite the bullet. I sat down on my butt, and I went down through this slush on these 2 flights of stairs. I probably had the coldest rear end in Beijing, but I got to the bottom of the stairs, no injury. That was my goal. And my jeans dried out. That's the way life goes. Fear of falling, Gina will pick that up and cover that for you. Now, develop a fall prevention program for yourself. Consult your doctor, and you have in your materials a handout. One side is check your risk for falling, and I'm not going to have you fill it out today because of the time, and plan for preventing falls. So if you take a look at that handout, take it home, sit down with a martini or something, not if you're going to fall, and fill it out and decide what your house looks like. Now, what are some of the things people in the audience have done to change your home so they're safer for you? What?
I hear grab rails.
Grab rails in the bathroom. Okay, what else? Get rid of throw rugs. Anything else? Stay in the moment. Yes, mindfulness. Better lighting. And that includes hallways. A lot of hallways are dark. You also should have lights at the top of the stairs and the bottom of the stairs. And while we're talking about it, you need railings on both sides of the stairway also. Okay? Your bathroom is full of dangers. Somebody mentioned grab rails. Again, bath rugs can slip and slide if you're not careful. And if it's a tile floor, that can even be scarier. So keep that in mind. What about your kitchen? Stay out of it. Good point. Well, this lady is saying keep things within reach. And I am vertically challenged, in case you didn't notice. I have a grabber, which I reach because I keep my paper towels in the top shelf, but I just get my grabber. I'm still standing on the floor and get the new towels down and so forth and so on. I also have a step stool with railings on it to hold on to, and I never go to the top one. If I can't reach it on two, I wait till a friend who's taller comes by or my daughter visits or whatever. Okay. What? That's what I use. You're right on. Okay, well, anyway, you do have the sheet in your materials that cover this in greater detail than I am. Again, other tips. Look at those shoes. Aren't they beautiful? Now, notice we all are wearing these. Medication side effects. Check your vision each year. Always wear safe shoes. Does everybody have a flashlight in every room? You should, because what are we having? We had an electrical out in Corte Madera yesterday or the day before, because I had to reset all my clocks. Handrails on both sides of the stairways. Raised toilet seats. I was in a public building recently, and the toilet seat was so low. And this one lady came out, and she said, my God, I had a horrible time getting up from the toilet. And I thought, well, what can I say? It was low. They are very low. And then sturdy plastic sheets for the bath. Now, the last two times I presented this, someone talked to me a little bit about how to get up, and it would have been helpful to this lady who couldn't get up off the toilet very well. I don't know how she managed, I didn't ask. But it's really important. First off, there's a few techniques that you can use. You can scoot forward, you can bend forward, and you can rise. Now, you can use your arms, but initially you may have to, but you want... Mike, I want a lavalier. I don't like this one. But anyway, so that's important to do that. Now, some people say scoot forward. Some say feet flat on the floor. Some PTs say bend your knee on one to provide leverage, lean forward, and stand up. Now, the other way you can do it, and this is more fun than the other way, and I'm going to have to put my mic down for 1 minute. You're going to have to go scoot forward, put your arms down, bring them up. Hallelujah, I got up. So, you got to think about that. The other thing you should do, now I know a lot of you probably copy programs and don't watch commercials. I refuse to do that because the commercials are timed to exercise. They're not timed to sit there and eat. Don't go in the kitchen, just like that man said. And so what you do with that is, and here I go again with this mic. Well, no, I'll manage. I do this at commercials. 10 times. Every or can you hear me? 10 times every commercial. Get your butt off that chair if you have to do this to do it, but cross your arms because you're not using your leg muscles if you're doing this, okay? Now, if you have fallen at home and you're by yourself and she needs help getting up, first, stay calm and you're going to call for help, but there's no help. You're going to examine yourself for injuries. Now, if you're okay, you're going to look for a sturdy piece of furniture or chair. Now, I want you to roll on your side, get up on all fours, heading toward the chair. And I want you to crawl. Let me get rid of the wire. Crawl to the chair. And let's see. I want you to put your hands on the chair, both hands up on the seat. And I want you to, using your strong leg, bend it and put the foot flat on the floor. And then I want you to pull yourself up. You're doing a great job here. Go ahead, pull yourself up and now move and twist and sit down. Yay, she did it. Okay, again, you've fallen and you do have a caretaker there to help you, but they're petite like me and they can't help you a whole lot. So you're going to stay calm and encourage you to take deep breath and examine for injuries again. You call 991 if injured and you keep them warm if you can. Also, if you have somebody down, they need to be moving as much as they can every 30 to 60 minutes because you can get a compression wound, and that's from pressure, from laying in the same position. Shift your weight? And so you're going to have to shift your weight so that, you get, even that much is helpful. So, if they want to get up, and you do, proceed slowly, stop if you get tired. We need 2 sturdy chairs, one by the head and the other by their feet. Okay? And what she's going to do is, again, she's going to roll over her side and assist them to a kneeling position. So roll over and get on a kneeling position facing this chair. That chair. And I taught all this to a friend, and she indeed used it. Now, okay, hold it right there. And Gina, you're going to grab that chair and come in behind her, here, right there, like right there. Yeah. Mm-hmm. She's holding on to that, but move the second chair behind her, okay? And then as she starts trying to get up, you're holding that chair. You have to have them pretty close together. Okay, then you slide this one under her butt as soon as you can. Are you that strong? Okay, and that requires some practice, and you might want to practice at home, that you know how to do that, and the other person does too, so that when it really is injured and you need some help. So, okay, I think you can use your hands to guide them, but again, you can't always, I can't lift people, I just can't. So keep that in mind.
So hello. Thank you all for, how's that? A little better? Okay, great. Okay. So one of the things I wanted to go back to is this idea of fear of falling. And in your handouts, you have a scale called the Modified Falls Efficacy Scale. I'd like to encourage you to look through this and take it on your own. We won't do that now, but you can take it home. And really what this is a measure of is your own internal fear of falling when you do various activities throughout your day. Some more simple, routine activities in your day, and then some outdoor using the front or rear steps of your home, like gardening or hanging out, washing, that kind of thing. And this correlates actually to the actual risk for fall. So you do have a really good internal sense of your own kind of risk of falling. But the other thing to be aware of, and Carol mentioned, is that as your fear of falling goes up, you're more likely to withdraw from meaningful activities and kind of start this spiral of disengagement and increasing your weakness and your well-being. So this is a good measure for you. If your score is below 112, that indicates fear of falling. And that's a good point to take action and begin to think about, what do I need to do to be sure that I feel more confident, that I feel stronger, more agile, and that your risk of falling is diminished. So I would encourage you to take a look at that. So in your booklet has a little diagram here, a few pages in, that shows these different aspects that are really important to preventing falling. And we've been talking about them. So we've been talking about strength, most definitely. Balance, how are you going to make sure that you're maintaining your balance, endurance, and flexibility. So you want to be sure that you get a little of this into your overall exercise plan, and that you're including at least some of this every day. Strengthening, you may drop down and do strengthening less frequently, but at least the endurance and flexibility and balance exercises more frequently. So in terms of strength exercises are going to build your muscles, and even a small incremental difference will make a difference in your fall risk. And you're never too old to increase your muscle mass and your strength, so it really does make a difference. And I'm going to give you a little quick demonstration here of a few of the exercises that are in your book. And why don't we go ahead and stand up if you're able and give some of these a try. We won't go through all of the repetitions, but we'll go ahead and practice. So the first one, I was running around this morning raiding my kids' supplies. The first one is a strengthening exercise for your hand. So you could use a ball. Tennis ball is preferable because it gives a little bit, but use what you have, even a washcloth. You just want something to have resistance in your hand. And you're going to squeeze it as hard as you can for about 3 to 5 seconds and then release. And so even you don't have anything to squeeze right now, you can go ahead and just make a fist and squeeze that as hard as you can for 3 to 5 seconds and release and repeat. And grip strength is actually a really powerful indicator of overall wellness and frailty. So very important, and also very important for a lot of functional activities that you'll engage in. So that's the first one, and you'll see in your booklet that it has a little picture. There's also a website that goes along with this Fit for Life that has short video demonstrations of each of the exercises, and then some videos of an exercise routine that kind of puts it all together for you into a sequence. The next one is a wall push-up. Anybody do wall push-ups at home? So we won't be able to get everybody to a wall in this situation, but I'm just going to demonstrate real quick for you. Before I go over and lose the mic, you're going to stand with your feet at about shoulder width apart, and you're going to have a sturdy wall in front of you, and your hands are going to be flat on the wall at about shoulder height and a little bit wider than shoulder width. Okay, Salama will demonstrate. Thank you. So she's going to lean in. Oops, a little slower, Salama. And then you want to hold your position for about a minute and then go back out. And as you go in, you can inhale, and as you push back out, you can exhale. You want to go slow and careful and have your, breathe regularly throughout all of these exercises. Very important. So there we go. Thank you for that. The next one is an overhead arm raise. And Salama, would you like to come have some of my cans of beans here? So I've got organic kidney beans this morning. You can also use water bottles, or if you have dumbbells, that will be fine as well. Bags of beans. You can do this one from seated or standing. You can, well, maybe standing is better for you all to be able to see her. So she's going to raise them overhead, but not, when you go up, you're not going to lock your arms. You're going to go up slowly and hold at the top and come back down. So everybody try that. Your palms are facing forward and come all the way up and then come back down. And again, very slow and controlled is going to be the most effective. And you would repeat that about 10 to 15 times, and then you can adjust the weight as you're able. Okay? And make sure you keep those arms slightly bent. You'll notice in all of these exercises, you're keeping your joints just kind of a little bit loose and slightly bent. If you're in standing, you don't want to, I have a habit to lock my knees out. You actually don't want to do that. You want to keep them a little bit lightly bent. Yeah. Okay, so the next one is a back leg raise. And so if you flip your book, we're on page 8 in your book, and you're going to stand with a chair in front of you. So if you want to yeah, we can do that. So go ahead and give it a try. And you can slowly lift the leg straight out back behind you. Yep. And bring it forward. Now your stable knee should not be locked. Your stable knee should be slightly bent. And then come back out and down. And you would only want to do this if you had something to hold on to. Okay, go out to the back and come back. You don't want to arch your back as you go back and forth. Okay? And then we also have a side leg raise, again, with the chair, and you're going to bring your leg out to the side. Stable leg is lightly bent. So I won't continue on with those because you do have the booklet and the videos are available. Oh, excuse me, last one is the toe stand. So you would stand with both hands on the chair, or one depending on your balance, and then go ahead and raise up on your toes and hold and come down. And raise up and hold and come down. Okay? So those are some good strengthening exercises. If you do go onto the website, there are more, but this is a good place to start. So in terms of balance, I wanted to talk about balance a little bit. And Carol laid a really good foundation for us, talking about proprioception and vision and our inner ear and our vestibular sense and how all of those things come together to help us maintain our balance. And sometimes people rely more heavily on one of those senses than the other, or they may have weakness in one area and that makes them rely very heavily on the other area. So for instance, if you notice a big difference in your balance when you close your eyes, you're probably very heavily relying on your sense of vision to maintain your balance. So you're going to have a much higher risk of falling than in the dark, or if you're in the shower and you close your eyes because you've got shampoo. So kind of that's something that would happen in a therapy session as they evaluated your balance, is trying to figure out what systems are you relying on. Another way that we can tell that is by putting you on uneven footing, for instance. So having somebody stand on foam, and now your proprioceptive sensors are a little bit messed up, right? Because they don't have really solid footing underneath them. So that's another way that you might challenge your balance if you wanted to strengthen that part. But you'd want to do that under the supervision or as part of an exercise program that was recommended for you after specific testing. In terms of the inner ear, we were talking about dizziness a little bit earlier. I just wanted to really highly recommend that you have a medical evaluation if you do have dizziness. There is a condition that's highly treatable called benign postural vertigo, where some of the crystals in your inner ear, they get in the wrong place in your inner ear, and they can cause a real intense vertigo. And a lot of times they can be moved through manipulations of the head and moved into the correct category, and it's almost an instantaneous correction of that condition. So very treatable condition. So always check in with your physician if you have. Anybody have benign postural vertigo? It's not all that uncommon, actually. And sometimes they'll drain the crystals into the right area, and then over time they'll come back and you'll have to do the manipulation again. Okay, so we have a few balance exercises. Good one is just standing on one foot. You want to do this always with something to hold on to. And initially, as you first start, you want to have both hands on. I don't, obviously, because I have the microphone. But you would stand for about 10 to 15 seconds, have good posture. My stance leg is slightly bent, and I would stand with that 1 foot up. Then, as I was able to challenge myself, as long as I had a sturdy object in front of me, a counter or a sturdy chair, I would go ahead and go to not holding on at all, and then an additional challenge point, or you might actually go to just fingertip first, and then you would go to not holding on, and then you would close your eyes. And for myself personally, I think I rely on my vision quite a bit, because when I close my eyes, it's really hard for me to keep my balance. So that's a good way for me to challenge my balance. The next one is called the balance walk, which looks really funny. But you're going to walk kind of just with an exaggerated step like this, one at a time. And as you go, and it's in your workbook, you're going to hold for about 1 second as you're up in your stance and carry on. And then the third balance exercise is a toe to heel walk. And you'll notice we were talking earlier about when you look down, how it's actually worse for your vision or for your balance. And you can experience that yourself if you look down doing this. At least in my experience, it's a little bit harder than if I look up at the horizon, which allows my vision to really help me orient myself. So you're just going to do a toe to heel walk. And hopefully you haven't had that cocktail that Carol's talking about. Or if you have, hopefully you're home on your own doing the toe to heel walk. Okay, so I did want to talk a little bit about Tai Chi, which is a really great way of improving your balance, and also focusing on kind of a mindfulness perspective, which is a very important part of preventing falling. And somebody did allude to that earlier, being mindful and present. Anxiety and multitasking, or what we call dual tasking, really diminishes your performance, and it increases your risk of falling. So as your risk of falling goes higher, it's more important that you're fully present in the moment when you're moving about. I understand that we have somebody here who teaches Tai Chi. Is that right? Is she still here? That's true. Wonderful. So, find an opportunity to take a Tai Chi class. I also understand maybe we have some flyers, and also for a matter of balance class, which is a way to really focus in on your balance over a committed period of time through a curriculum. So I don't personally do Tai Chi, so I can't demonstrate anything for you. Flexibility, we're going to talk about ankles, back, thigh, shoulder, and upper arm. So for ankles, if you were seated, you're going to put your legs out in front of you. You guys can do that now and stretch, and you're just going to point and flex your toes. And you might, if you don't do that very often, you might notice a little cramping in your feet as you point your toe. You can do one at a time, or you can do both of them. So that's very important. In terms of your back, if you want to turn in your chair and look over your shoulder and really feel that stretch. And again, this is in your workbook. And you can switch and do the other side. It feels really nice. And then for the thigh, you would do this. So if you were doing a sequence of exercises, you would likely want to do this. Whoops. You would want to do this while you were doing your balance exercises, but you're going to hold on with one hand and then pull up your thigh behind you and just give a little pull on that. That may be difficult for some of you. And then lastly, the shoulder and upper arm, we'll use a towel. Salma, you want to do this one for me? There you go. So she's just going to, yep, she's going to throw that over her shoulder and then hold on in the back and give herself a stretch. And she wants to keep this part of her arm very close to her head as she stretches down. There you go, just like that.
Pull down.
Yeah, pull down. Yeah. Okay. And then you can switch and do the other side. Okay, so there's our balance exercises. Endurance exercises, lots of different ways to do endurance exercises. If you're incorporating it into just a basic daily exercise routine, you can just do some marching, walking around. You can do your what Carol does on the commercial breaks. Lots of ways to do endurance exercises, but very important. And as I mentioned, there's some good free videos on the Go for Life website. And of course, please remember to check with your doctor before beginning exercises. I did want to mention, we're here to prevent falls, absolutely. I do want you to think about if you do have a fall and you're not able to get up, or perhaps you have a fracture and you really can't get up, some things that you can do preventatively in order to prepare for such a thing to happen. So there are, of course, the call buttons that people can have, but you can also have a few places in your home where you have some bottled water, some non-perishable food on the floor, maybe a blanket, because if you're down for a day or so, which unfortunately does happen, and I've certainly seen that in my work in rehabilitation, you want to be able to have a blanket and prevent shock. And a cordless phone that you could get to on the floor. So, if your only phone is up on the wall in your house, something to think about. A couple of places in your home where you have water, non-perishable food, and a phone, and a flashlight in every room. Yeah, okay, thank you.
Okay, let's see. How to fall safely. Classes are being developed today to teach folks techniques how to fall safely. I cannot find one in the Bay Area at this point. So I'll be just discussing some of the techniques today, and you might be able, if you can find a class that does it, let me know, because I haven't found them, and I think Lauren checked for them also and couldn't find any. She found the wonderful list of balance classes that she gave you. So I'll go over some of the principles today, and I'm going to go fast so that Salama can demonstrate her falling technique. Falling safely, what to do if you're falling. Bend, roll, protect your head, use your hands, not your wrist, and yell. There are those people that believe when you yell, you relax. And you've all seen toddlers fall. Do they get hurt? No. How about a drunk? No. So indeed, act drunk. Have the martini. Always protect your head. Tuck your chin, lower your head, and turn your head to the side. You don't want to hit your face. I have a friend that did that, and boy. You might want to put your arms up to protect your head also, and that will save you a lot of TBI. What did I say happened with TBI? Very traumatic. So if you're bring your arms up or put them in front of you if you are falling forward, behind you if you are falling backwards, okay? And that's kind of the way it looks. Turn as you fall. You want to fall as much as possible on the fatty part of your body, if you can. It's well padded for, and it would be, prevent some injury. So turn as you fall, if possible. You don't want to go flat on your back, because that could be dangerous too. Keep your arms and legs bent. And furthermore, if you're really aware of squat, because you're lower to the surface, okay? And you will have less velocity and less stress when you hit the surface. Keep your arms and legs bent as much as possible. Squat, I can't tell you how important that is. Stay loose, relax. Some people say scream as you go down because you'll relax when you're screaming. Also, breathe out as you fall, if you can get all this together. I mean, it's hard, because when you fall, it's usually fast. Stay loose. Spread out the force of the fall, and try to spread out the impact of the fall. The more distribution you have of your body weight, the less it'll spread out the impact. Salama's going to demonstrate for you, because she's a fall expert here.
I just wanted to share my 9 most memorable falls real quick. In 1974, I had a new 10-speed bike, and my husband said, "Oh, don't do the front brakes more than the back brakes because you pulled over the bars." So I was coming home, and I was riding, and I had to make this curve, and I was thinking of that. Oh no, I can't squeeze too hard, and I hit the curb and fell off. But I skipped my knees, came home, the kids and Dad were looking at me because I walked the bike home. I was near home, and my kids' eyes were saucers, and it's like I was bleeding from my knee, and moms don't bleed. They take care of boo-boos. They never have them, So anyway, then in 1990, I was learning how to cross-country ski, and my skis were about to hit a hole, and I was thinking, how do I go over that or under that? I didn't know, because I didn't know you just tip the balance thing yet. And the tip of the ski hit the hole, and I face planted. And I called, help. And the instructor came to me and said, you're okay, took my backpack off, get away from the snow, all that stuff you taught. And I said, did I break anything? Is anything bleeding or my teeth? He goes, you look just as beautiful as ever. My face was cold, I couldn't tell. We had a dentist in our crew, in our team, and I said, do a face, head, neck, in my mouth, check. I want to know if I have any broken anything because I couldn't feel anything, my face was cold. Okay, then that same year, 1990, doing downhill skiing, you know that commercial, The Thrill of Victory and the Agony of Defeat? Remember that commercial? Well, I did the agony of defeat. I was like rolling down the hill. The wedge didn't slow me down. I was like literally rolling. And when I finally came to a stop, my instructor was right there, halfway down the hill, right there. And I looked up at him and he said, you okay? I said, yeah, yeah. And he said, I said, don't help me up. Tell me how to get up. Okay? Then, 2000, this is about every 10 years, right? 2000, the glassy floor at work. And this was the only one in which I actually hurt myself. The wax, I couldn't tell which side was dry wax, it was shiny, and the wet wax was shiny. And I turned the corner and my foot hit the wet wax. Arms and feet in the air, that's what I remembered. And I came down, and then I hit my head on a cart. And I didn't know, because I actually was unconscious for a second, TBI. The nurses said, oh, she's bleeding from her head. I had a little laceration, and I didn't break anything. And I had to have physical therapy I had a bruised muscle, so I had physical therapy. But also I did have brain rest, which they didn't call it that then, because I had headaches the next morning. So I did have, got to stay away from work and not watch telemetry, people's rhythms, for a week until the headaches went away. Okay, 2009. I'm in Germany, Navy nurse. I'm going to do one more minute. Navy nurse. I'm mobilized to Germany. And she talked about proprioceptors. I was going down some brick stairs. I guess they had smaller feet in those days. And I was with a doctor, and she was at a little ways from me in our team we were sightseeing. And I stepped on the first step. And the second step, she said, I saw you go into air. She ran over to me. I was down on the ground. Nothing. I had a little skint knee. That was it. Slippery slope. Also in Germany, wet driveway, was wearing shoes without treads on the bottom, heels, boots, no tread. And so I just slipped. It slide into first, folks. Slide into first. Do you want to see the fall?
Yay! Uh-huh. Right. On your butt, right. Yay! I did want to mention there are 2 labs working in the United States today at the University of Illinois. It's called the Slip and Fall Lab, and they are working with older people. They have a tether. They have a track on the ceiling, a tether, and a vest, and they actually trip people. And after training, they do well for a year without any further falls, but they need to be retrained at the end of a year. The muscle memory changes. There's also one at the University of Delaware, which is doing a similar thing, only they're working with stroke patients. If you want to work to enjoy old age, you will have to work at it. Thank you, and have a joyful day. You've been a great audience.